because it leaves their shoulder pretty much in a neutral position. What I'm going to do here is put his arm in his side, and I'm going to take my more superior hand and hold his elbow just to hold it for stabilization. I'm going to take my mobilizing hand, go up in his axilla. One of the principles when we mobilize is you want to put your forces as close to the joint as possible. It's different if I push up here close to the joint than it is if I push down here. My leverage is very different. So I'm going to go up into that axilla as far as I can. I'm going to hold this elbow here.
Sorry, you're getting that whole nerve.
Back here?
Yeah.
Oh. Didn't hurt me a bit. Okay.
That's nice.
So I've got a good steady position. I like to put my forearm across their chest, because what I'm going to be doing is pushing like this. That's going to gap his humeral head this way and stretch it. Okay? So I hold him here and then just push out. So mainly it's holding here and pushing. It's not so much pushing both at the same time. You can actually feel the humeral head gap with the acromion. If I needed to feel that and see how much it was going lateral, what I'll usually do is use my thigh and hold their arm in place with my thigh, put my hand under here the way I just did, and now I can palpate the gapping of the humeral head right there. The other thing is, up here in the brachium is really tender, and we have brachial artery there, and nerves, the axial nerves running there, and it hurts, especially if I get really pokey with my hand. So we want a broad, flat contact with your hand to spread your forces out. You may need to have padding there, okay, and soften it up for the patient. It's not uncommon that it's a little bit tender. So I put this under here like so, up there as high in the axle as possible, hold his elbow, and push to the outside. When I get him here and I have nice tension, I can oscillate. Short strokes at the stretch of the capsule for about a minute. That's a mobilization, a grade 4 mobilization. We're using the bone to stretch the capsule. If he can tolerate a minute, if he can't, then I do it for less. Give him a break for a few minutes, I might come back for another round of a minute and do it again. Mobilizing is very slow at getting these capsules to loosen up. They don't loosen up real well. Did you have a question?
Yeah, I was curious about people who've had a history of either shoulder dislocation or AC joint separation or things like that.
It's really interesting that we're usually talking about different populations. Those that tend to get separations and real instability tend to be younger, active populations. Those that tend to get adhesive capsulitis are going to be middle-aged and older kind of folks. So I've never seen somebody who had a lot of instability then go on to get adhesive capsulitis. They're usually mutually exclusive, so they don't compound the effect. However, if somebody had a really unstable shoulder joint, I would lessen my forces, go more gently, trying to stretch the capsule. It would definitely make it more difficult. You'd have to be much more specific in your forces and more gentle. But it doesn't happen that often. Yeah.
So would you have them come back like once a week? Or
So I'd probably, in the beginning, I'd probably want to see a patient, give them a date in between to recover. I'd want to see them about 3 days a week for probably 2 weeks, and then begin to taper off a little bit. These sessions, and this is the first one, it's pretty gentle. These sessions can be painful, and you are inducing sometimes more inflammation that you need to manage. Put some there's a lot of ways to manage inflammation, but anti-inflammatory creams, or give them a home routine, or whatever you want to do to manage the inflammation that you've induced. So let's say I do this for a while, he starts to show me improvement. Now, according to how much he improves, I can enhance this mobilization. For instance, oh, you know what I forgot to show you? Let's go back to this one. Take this hand and put it right here in your chest. That does two things. First, it creates a boundary to protect the breast. The other thing it does is it gives me a lever to push on the back of my hand, on his hand here. I can use it and push against it this way. So that's a good idea to put their hand there. So he's improving. Now I can up the ante a little bit. Let's say we can get him to the point where he has shoulder flexion like this. I can take this then and maybe internally rotate it so his hand is across to the other shoulder. Come over here, place his arm on my shoulder. I'm going to try to put it up against my neck and kind of nuzzle it in there so I can have control of it, like this. I take these hands, interlace them, get down as close to that humeral head as possible. What I'm going to be doing is pushing down, holding it, then pull it out laterally. This is a scoop out like this. When I pull out laterally, I'm also going to drive my shoulder forward. If you just use your hands to pull out, it's going to take strength. But if you use your whole body, you have leverage working for you. You won't have to work as hard. Okay? So let me show you what this looks like. So I'm out here like this. Down, hold, scoop. Down, hold, scoop. Okay? And remember,
Now when, sorry.
Huh?
When you're saying hold with the shoulder, or what do you mean?
hold down
Okay.
while you're scooping out. You can also go into mobilization like this and just oscillate. Okay, holding those positions.
Now, Dr. Cresta, are you pushing with your shoulder on his elbow forward?
A little bit. Doesn't take much movement. I'm basically taking my whole body and doing something like this. That's about as much as I'm moving. That drives my elbow forward into him. Okay? Scooping down. Oh, by the way, from this position, I can change internal, external rotation and scoop out this way, scoop out this way, or this way. What most of this comes down to is feel. Everybody's going to have tightness in different parts of their joint capsule. So we're going to use this in part as an assessment, and when you feel that something's not moving the way the rest of the capsule is, you stay in that vector, and that's the vector that you mobilize in that direction. It's so much by feel. This is a very loose joint, and you'll see as we go through it, you'll feel something's different when I move it this way than when I move it that way. So I'm going to stay in the tight area and keep mobilizing it in that direction.
Is it usually the most painful vector?
Yeah, that's where they're tight. That's where they're going to have the most pain. All right, so pulling down out here this way. Let me have you move down on the table. These tables are great with a little bit more. Great for lying prone. They have these shoulder cutouts. They're not so good for this work. I want them on a stable platform. So I either move them down or turn them around on the tables so they have secure shoulders. Push down, hold it, and scoop inferiorly. Push down, hold it, scoop inferiorly. Drive your shoulder forward and pull down. Okay? If you wanted to, internal rotation, scoop out a little bit, down a little bit, oscillate on one end. If I find a tightness in a particular area, stay there and oscillate for a minute. We doing okay? I know it's nondescript because that's the way it is. You have to find the tight spots. And they're not going to be tight in every single direction. So you have to search for those tight spots. Is there another question?
I have a question.
Yeah.
When, in a testing situation, are you gonna tell us, like, they have the most restriction in a certain plane, or?
I'll ask you to
Something like that?
demonstrate the pure cardinal direction. Demonstrate scoop out for me. Okay, just do it as if it were a cardinal restriction.
And Dr. Agresta, just to clarify, with all this, someone that's in that much pain with frozen shoulder, you're going to be doing, are you putting as much pressure as you're putting? Probably
No, you make a good point, and here it is. There are various grades of mobilization means, various levels of force that we're going to be using. We'll start out very gently for people who have more pain, and over time add more force. This can drag out for long periods of time. I mentioned to you that I've treated a lot of frozen shoulders, and usually, again, you get them in the early freezing stage by the time they report to you. And I would say that it would take about 6 months, 6 to 7 months to resolve that problem. Then I discovered that if I sent them for acupuncture at the same time, that I could get them through this in about 4 to 5 months. So I really recommend coincidental acupuncture while we're doing all this. But that aside, we said this is a self-limiting problem. If we wanted to, all you have to do is wait about 18 months, and it tends to loosen up on its own.
Oh.
Problem is, there's a lot of pain and dysfunction for 18 months, and people most often choose therapy, trying to get through it a little bit sooner. But it is a self-limiting problem. Okay? So, we scoop laterally, we scooped out, we scooped down. Let me show you what we use. We call it a multi-directional kind of mobilization. Again, this just depends on how they're performing for you, and gives you some control, more control over what's going on. So what I'm going to do is take his arm, say that he can get it to this position to begin with. Some of them couldn't. And I'm just going to rest it on my thigh. I'm going to take both hands, and I'm going to get in nice and close on the neck of his humerus right here, and just encircle him like this and interlace my fingers. So I've got a good grip on him here. With this grip here, I can lift him anterior, and usually people are not tight there. Usually the problem anteriorly is instability. So I don't take many people up like this. I can push back on the capsule this way. I can push superiorly. I can push inferiorly, wherever I feel the tightness. Most people's tightness is posterior and inferior. Okay? Or I like to do this as well. In this position here, is simply take it and move it in circles or circumduct it. And doing this, I can feel certain parts of the capsule that are tighter than others. Moving it around, it should all be nice and loose, but you'll feel that things get hung up going in one direction over another. It's okay. Right about here is a little tight, right back in the capsule. So I'd stay there and just oscillate on that area slowly for about a minute at a time. Okay, now his isn't bad, it's just a slight little tightness. You'll feel some very distinct tightnesses though. Any softball pitchers here?
Not for years.
Hey.
So
No, fast pitch. We had a couple yesterday. Shoulders were a mess. Volleyball. Volleyball is usually an anterior stability. Yeah. Okay.
under
All right. Any questions about those four then? Then let's pair off and let's take a subject through all four of those. Lateral, inferior, then the other lateral scoop, and then this multi-directional kind of assessment scoop as well. Give it a try. You'll see.